Okay, well, welcome everybody. My name's Stuart Wildman. I'm the chair of the RCN History of Nursing Forum. Before introducing Anne-Marie, I'd just like to say that the History of Nursing Forum is very active in promoting nursing's heritage and supporting member interest in the history of nursing. If you are a member of the RCN, you can join the forum, sign up to our Facebook page and volunteer to help with our work. We are currently looking for members to sit on the steering committee and would welcome applications. Now, back to the main business of the day. For those who do not know her, Anne-Marie Rafferty is Professor of Nursing Policy and former Dean of the Florence Nightingale Faculty of Nursing and Midwifery at King's College London. She is a historian and workforce and policy researcher. As part of her work, she was seconded to the Department of Health to work with Lord Darcy on the next stage review of the NHS and awarded a CBE for services to healthcare in 2008. She served on the Prime Minister's Commission on the Future of Nursing and Midwifery in 2009. She co-led a student commission on the future of the NHS and was a member of the Parliamentary Review of Health and Social Care in Wales, which reported in 2018. Anne-Marie has been a recipient of various awards, including the Nursing Times Leadership Award in 2014 and the Health Service Journal Top 100 Clinical Leaders Award in 2015. And she was inducted into the Sigma Theta Tau International Hall of Fame in 2016. She holds fellowships from the Royal College of Nursing and the American Academy of Nursing. Anne-Marie is currently President of the Royal College of Nursing and has led the RCN's Staffing for Safe and Effective Care campaign. And as well as all of the crucial work she has undertaken and is undertaking, she is a fantastic historian, having written books and articles on aspects of the history of nursing. Therefore, it gives me great pleasure to introduce Anne-Marie Rafferty this evening, who is going to talk about Florence Nightingale's legacy. Anne-Marie.
Well, thank you very much indeed, Stuart. I hope everyone can hear me for that fulsome introduction. I was expecting you to say two things. I was a historian and president of the college, but there we are. It's absolutely wonderful to almost see everyone, but actually to be gathered here with you and to talk about Florence Nightingale, her legacy really, and why she remains an icon today. So I want to, of course, pay tribute to colleagues who I've collaborated with, have helped me put this talk together. I'm going to not just draw on some historical analysis, but also some research I've been involved in, which has relevance to Nightingale's kind of methodology, I think, in terms of workforce and what she would be interested in if she were actually here today. So just a few words about her as a character and a celebrity and what made her tick as a person. I think this is a really fascinating topic. A little bit about looking at her contribution in the round, because of course nursing was only ever a relatively modest part of her contribution to society. And then reflecting on why is it that we're still really obsessed by her in some ways, and to what do we owe her contemporary relevance? Just to make the point about celebrity, I was trying to get this as my virtual background, but unfortunately my techie skills failed me again. But I love this slide because it is very much a sort of Warholian view of Nightingale. And I'm sure if she had been around at the factory in New York in the 1970s and 80s, well, I'm sure, you know, Warhol would have made a beeline for her, because in her day, she was one of the two most famous women in what was then the British Empire, Queen Victoria and herself. And much written about, of course, as well. The magisterial book by Mark Ostrich, I think it's an unbeatable biography in 2010, and from which I'm drawing some of my comments. And a book that Siobhan Nelson, a great friend and colleague, we edited in the same year. little bit of revisionist analysis there, and also some contemporary focus. And I'm going to be drawing on a chapter that Rosie Cresswell and myself actually wrote in that book. And then, just to give you a sense of the great kind of breadth of Nightingale's interests, suggestions for thought, really her ruminations on religion, and that is a kind of almost a Wolfian stream of consciousness download of all the things that she thought about religion, but teaching it very much to the poor. So her kind of empathy for those who were much more disadvantaged than she was came through to inculcate in the poor the sense of the moral imperative and how to live a good life, basically. And well, she did have her own share of the good life, because these are 3 houses. And in fact, that reminds me of a wonderful book that's going to be produced this month, published by Paul Crawford and colleagues from Nottingham, called Nightingale at Home. And that's not just about the actual buildings that she occupied, but it's really about the role of home in her work here in the home, as well as actually the whole concept of home and the cultural significance it occupied, not least in the Victorian imagination. So this is left, South Street in Mayfair, where she spent much of her later life. And up the top there is Lea Hurst in Derbyshire, which now I gather you can actually rent Florence Nightingale's bedroom, or it might even be more extensive than that, for a stay. So recommended. That would be quite a thrilling thing to do. And then down at Embley Park in Hampshire, which is a much more show-offy house, really. And I think this is a point that Paul and colleagues make in their book, really demonstrating the kind of wealth and the cultural profile of the Nightingale family. So here we are. And it's interesting too, because she was incredibly well networked. As many of you will know, she was from an upper middle class family, and really the political and intellectual aristocracy of the day were frequent visitors through the dining and drawing rooms of the houses, particularly Embley Park. And on the left there, Sidney Herbert was, of course, a neighbour in Wilton Park, and above him, Lord Palmerston was a neighbour. Embley Park was sandwiched conveniently between these 2 houses. And of course, not coincidentally, they became 2 men who'd occupy a very important role in her life. But here, of course, it's not that she had an easy time of it, did she? Because she's agonising over what she should do with her life. I mean, we're in lockdown now. Many of us are thinking reflectively about, well, what's it all about, really? What's important to us? And she, of course, was doing that herself, and wrote about her vocation, God speaking to her, and this compulsion, I think, to do something meaningful and useful. And interestingly, she was also, people say Florence Nightingale, obedience and conformity, not in your life. She was a rebel. And I think, she's that sense of feminist outrage has been discussed by feminist critics and also historians of gender. But this was a great work, which was, again, a novella, but not actually published until, gosh, I think it was about 1920, in Ray Strachey's The Cause, which was a history of the suffrage movement. So in that, you can see from the title there, she was it was an outcry against the enforced idleness of Victorian women. She was really adamant that women should be deployed to do something useful, and that's what she was determined to do with her life, rather than frittering it away as she saw it. And this kind of slavish devotion to conventionality was not something that she had any truck with. And she uses throughout her writings, and English lit students, I'm not sure her work has been combed over to the degree that it merits. In her power of her rhetoric, her rhetorical skills were outstanding. Sacrifice. She's always painting kind of dramatic picture to persuade her readers. And of course, latterly, she does that with numbers as well as language. But she became a mythological character quite early on. And this is the Longfellow illustration of the Longfellow poem on The Lady with the Lamp, which gave rise to her, the beginnings of that mythology, where she was depicted as this, saintly, shadowy figure shuttling her way through the wards. But it was really this man, William Howard Hastings, who was a reporter for the Times in the Crimean War, who really brought her celebrity into sharp focus, and the scandal in the Crimea through his war reporting and shaming the British government into action. And it felt like COVID now, the public profile of nursing, or the want of good nursing compared to other countries such as France, the Sœurs de Charité, was something that impelled the government to act. So I think there are lessons for us actually in how we use the media there. So it was really that propelling of the images from the Crimea that stimulated the sense of moral outrage of Sidney Herbert, and eventually the government to send out Nightingale's party. I'm skipping quite a lot of her life here, but just moving into her fiendish fascination with numbers. And of course, she was schooled by her father in mathematics, and latterly she had extra lessons. And in statistics, she became, of course, the first woman to be a fellow of the Royal Statistical Society. But she was also an innovator in representing data, and she would be very much at home today with infographics and data visualization. And, what she was keen to do was at a glance and to portray a story. Every picture tells a story of what was actually happening in the inequity between deaths caused by the ravages of war compared to the one of nursing and infection. So she was able to, in particular, to demonstrate that in a very economical kind of way. And of course, that gave her an interest in data systems and administrative data and routine data, which we still rely on today. One of her great contributions was trying to find or advocate for standardized modes of data collection for hospital statistics. And she mediated those messages and communicated them through the international statistical congresses, which were actually up and running towards the end of the 19th century. These international congresses were, very, very popular in a whole range of different subjects. So that was what she had papers read. And really designing those data systems was a huge contribution that she actually made. And it's something which we still struggle with today. You may have heard there's a wonderful Radio 4 program called More or Less, where they dissect, numbers in a whole multiplicity of different areas of public discourse. And one of those was in COVID reporting. Well, no country has there is no standardized way of reporting COVID deaths. So we have all of these debates about whether is Britain really the third worst in terms of its overall mortality rates? Yes, it is. But there are all these caveats, etc., etc. But one person who really influenced Nightingale a lot, she had a great kind of respect for Adolf Quetelet. He was a Belgian statistician and sociologist, really one of the founding fathers, like Auguste Comte and others. He was very much about trying to sort of classify behaviour and activity in groups in society. And he was very fascinated by what made people criminals and induced criminal behaviour. And to do that, you had to have a more or less type equation. He invented the whole notion of the mean, so from which we derive standard deviation. And that mean was very important in helping to say if you're more or less, and also, how far you are from the mean point, the standard deviation. So, but he was looking at the kind of bell curve of behaviour, and his actual the book of his statistics she was writing avidly in the margins. There's a copy of that in the British Library. But it's not just the actual understanding the calculus of numbers, methodology of mathematics. It's actually how to use numbers, again, as we saw, to communicate with policymakers, and also how to move them to action, that she was very, very tuned into. I mean, she would have been absolutely working in, you know, the nudge unit in government on behavioural economics. You know, she would have been very much at home there, and, you know, helping to create kind of programs of how do we influence large-scale behavioural change. So it was evidence she was using as rhetoric to persuade her audience of a particular case and position that she was advocating. Of course, the most popular work that she produced in 1859 was Notes on Nursing. It's classic. It was a blockbuster at the time. It's hard to imagine anything. Well, maybe Christy Watson's work would come into the same category. But of many who could emulate, 15,000 copies flying off the shelves in the first month of publication. And, you know, again, reading that book, what strikes you is the kind of rhetorical beauty and economy, as well as the aesthetics of her prose style. I mean, second to none, conjuring an image in the imagination to say 1,000 words. And, you know, it was, of course, designed and intended for heads of households, how to look after people in the community. And again, with COVID, gosh, most of us have been in the community. I've, you know, having had COVID myself, certainly could have done with a good old vade mecum and linking up with other people, how to deal with the invalids at home and reassure the public. I think that's another big thing that she was actually, it's the psychology of illness, how to entice people to eat, you know, small, dainty little delicacies that you could tempt the appetite with. And what comes through in all of her writing, flowers brighten up the colours of the sick room, was what an incredibly textured understanding of the experience of illness that she had. She didn't have much nursing experience before. She actually wrote that, you know, she'd been superintendent in Harley Street's institution for sick gentlewomen, and then out in the Crimea itself, which of course was a traumatic experience, and she probably, you know, some experience or exposure to PTSD. But the encapsulation of exquisite empathy in that work is quite outstanding and staggering. And then, of course, she was also learning a lot about infection, one of the biggest killers at the time, and theories of miasma and contagion, and designing hospitals so that they were well calibrated to minimize the transmission of infection. And of course, today, you know, this is from the Nightingale archive itself. We are in exactly the same position with the Nightingale Hospital, plural, where, of course, large buildings, and of course they had to space the ventilated beds out accordingly with regulations. She actually specified the cubic meterage of distance between beds. So she was incredibly kind of precise. And hygiene, hand hygiene, she advocated that for the first time, really, in I mean, she wasn't the first to advocate for hand hygiene, because obviously Ignace, why do I keep saying obviously? That's rather irritating, Anne-Marie. It might not be obvious, so excuse me. But actually, Ignace Semmelweis was the first to advocate hand hygiene. But basically, I think she, you know, marketed the idea and expanded and amplified that message through her own writings. Because as we know, hygiene was very spotty in 19th century healthcare. And here she is, of course, it wasn't just hygiene, it was also understanding the environment, the kind of ecosystem in which care itself was delivered. And it's interesting coming up to, you know, to the present, thinking about how important her teachings actually are, to look at where care is heading in the future. Her kind of fascination with data and numbers this is an article from The Atlantic. Nerds, why nerds and nurses are taking over the US economy. Job growths are predicted in the future to be in these three areas from the US Bureau of Labour Statistics: care, digital computers, and clean energy. And actually, nursing brings all of those three things together. And look at what we've got confronting us. Now we're in the COVID epidemic. Many of the people who are worst affected, of course, have got pre-existing conditions. And more of us are accumulating these conditions as we age. Diabetes, for example, this global map. Diabetes is not just a condition now of the high-income countries. It's increasingly of low and middle-income countries. And, you know, that is a global pandemic in and of itself. I'm using this opportunity to advertise a book we produced last year about the importance of nursing in actually strengthening health systems. And we're learning more and more about that through COVID, where you have very, very fragile numbers of nurses. Then you have poorer resilience in your health system. And we know from this State of the World's Nursing Report from WHO, launched just before International Nurses Day, that we're short of 6 million nurses. That's almost a quarter of the entire nurse population are missing from action. I mean, that's, what would she say if she were here today? She'd be completely shocked and scandalised. And she would brook no tolerance of that. I'm sure she'd be beating a hasty tract to number 10 and knocking on the PM's door as we speak. But I think another quite, point on data. This is some data from a study that I was involved in helping to lead for the UK, demonstrating in Europe, and there have been previous findings from the US, about staffing and its impact. Why is that nursing important? She articulated that so beautifully and exquisitely. And here, it's the 20th century, because this was, well, no, actually, it was the 20th. No, it was actually the 21st century. It was the 20th century in 2000. No, it was, sorry, the first paper demonstrating this in Europe was 2007, which we published. And then again, this is in 2014 across Europe, that, this correlation between nursing, staffing and patient mortality. But it's not just the numbers of nurses impacting on patients. It's also the way nurses are educated, the capability of nurses themselves. And we found that the better educated nurses are, the lower the mortality for patients, even taking into account the skill mix. And we started to model this in a way that demonstrated that every patient added to a nurse's workload was associated with a 7% increase in mortality after common surgeries. Every 10% increase in bachelor educated nurses associated with a protective effect on mortality. And if we were to actually moderate these two variables, which are modifiable, how well we educate nurses and the concentration of those in the workforce and the workload of nurses itself of 1 to 6 and 60% bachelors, we would be able to save 3,500 deaths a year across Europe. But of course, we're in a state of acute shortage. Many nurses are, we started off COVID pandemic in this country with a deficit of 40,000 nurses, and the college has been campaigning on that, but also high levels of burnout. In fact, England across Europe had some of the highest levels of burnout of any of our European peers, and that was when we collected data in 2010. We're now becoming increasingly aware of the tax and the toll that COVID is taking on our workforce, and therefore we've got to plan the support in place. We can't do that alone. I mean, Nightingale's kind of, interest in design is highly relevant today to co-design projects in quality improvement that are actually the norm of how to do good design and re-engineer the patient experience along the way in order to improve outcomes for patients. And, there is this kind of myth, I think, that's been about that millennials are not interested in nurses. COVID, interestingly enough, seems to have stimulated and triggered more millennials coming into the workforce and the demand for nursing courses, which is a good thing, thank goodness. But it's by no means anywhere near even scratching the surface of getting near this shortage. And I'm very worried about the whole sustainability of the nursing workforce moving into the future. So there's good news there for our young next generation Nightingales coming into the workforce. And that legacy, of course, still lives on through the Nightingale hospitals, which are hibernating at the moment. And this huge kind of hangover of did I say hangover? I'm not talking about my personal experience. I'm talking about a hangar of a place down at the Excel Centre, which was, you know, awesome in its scale, 4,000 beds, and very interesting, where, you know, infection control training and ICU ventilating training course was rolled out massively. I just thought I'd sort of put this little slide in because this is Nightingale in her more advanced years, when she very efficiently was able to work from her bedroom. Well, we're all doing that now. I think, you know, she would have been very happy in lockdown and very comfortable with lockdown as she retreated, possibly because of her own exposure to brucellosis, from which she nearly died in the Crimea. She may have had some kind of post, you know, brucellosis fatigue throughout her life. There are various theories, but I think one of this, why was really Nightingale such a success, was because she didn't really give an excuse for anything or anybody, and that's a very important part of her gritty character. This is just me being slightly flippant about how readily she would have taken to lockdown. That was a large part of her life. But I think she also would have been in the forefront, in the vanguard of AI, machine learning, and, you know, big data. Just to finish off, really, I think in thinking about policy making, I mean, a lot of us are worried and living in the spirit of fear, and we have to somehow get ourselves out of the spirit of fear and into a spirit of confidence in actually advocating for what we believe is right for the health system moving forward, the health and care system, because we need a settlement on social care as well as the NHS moving forward. And we've got some great, you know, I think, support for that from the State of the World's Nursing report, mass investment in education, decent working conditions in terms of pay, and also the work environment. And of course, investment in leadership, big time. And I guess just to end on, never lose an opportunity. A crisis is an opportunity to urge a practical beginning, however small, for it's wonderful often in such matters. The mustard seed germinates and roots itself. We need to take advantage and build back better, as Nursing Now campaign is saying. We need to ensure, and this is what often happens with crises, that we do actually design a better future moving forward. For surely, unless we're making progress in our nursing every year, every month, every week, ticket, I can't see what it says there from me, we are going back. I think Nightingale should have the last word.